This is episode 40 of the Real World Paleo podcast. Hi, everyone. I'm Christine Lehman, a nutritional therapy practitioner and the reverse diabetes coach, which is also the name of my website. I help clients reverse diabetes naturally, lose weight, and improve their health. I see clients by Skype and in person. Just remember, while you're listening to the show, advice and information we provide is intended to be helpful and informative, but is not a substitute for medical advice or treatment. I am really delighted to have Andrea Grunberger Moore on the podcast today to talk about how she uses physical therapy and pain management techniques to treat various conditions. So I want to welcome you, Andrea.
Hi, thank you so much. I'm really excited to be here.
Cool. So I want to introduce you to our listeners. Andrea graduated from the University of Michigan with a degree in movement science and then received her doctorate in physical therapy from the Medical University of South Carolina. She completed Evidence in Motion's orthopedic residency and is a board-certified orthopedic specialist. And I have to say, the first one on this show.
You make me sound so fancy.
Well, you are. After working as a physical therapist, Andrea realized that there was a large piece missing in her ability to return people to their optimal health and functioning, so she pursued nutrition. She is a certified nutritional therapy practitioner through the Nutritional Therapy Association, which is also the same certification I have. She uses her skills and services to help create a safe space for her clients to begin their health journey and helps them identify their optimal path to healing and achieving functional movement and strength. Andrea and her husband, Adam, founded their business, Life, Liberty, and Health, together to achieve their belief that everyone deserves to live a happy, healthy life. So, before we get into the question about how you became interested in all these aspects of your career, I was wondering if you could just explain to us, what is physical therapy?
Yeah, so it's a great question, and it's actually a question that physical therapists themselves have a hard time answering. So I went to go to Google to start with that, since I knew you were going to ask me this, because I was just curious what it said. So now when you type into Google, definition of, it'll pop something up. And
yeah, I'm a big fan of Wikipedia, by the way.
Yeah. So its definition was the treatment of disease, injury, or deformity by physical methods such as massage, heat treatment, and exercise rather than by drugs or surgery. And I was like, wow, that's a really crappy definition.
Yeah.
That's terrible. Rather than, drugs or surgery is really good. But it really does not encompass what PTs do. In fact, that's kind of like old school rehab PT. Massage and heat treatment are, that's not what we specialize. That's not what we went to school for. So while those might be something that you find in a PT clinic, we do a lot more than that. So Wikipedia actually had a much better definition. So it talked about how physical therapy remediates impairments and promotes mobility, function, and quality of life through examination, diagnosis, prognosis, and physical intervention. And the therapy uses mechanical force and movements. So, I like to think of PT as a way of optimizing movement and getting your body to its fullest potential. And that can be a huge range. PT, a lot of people think of as rehab. And they think, I would only see a PT if I'd been in some bad car accident or I broke my arm or, my doctor made me after I fell and broke my hip, something like that, or just, got a hip replacement. That's when you see PT. But really, it's so much more than that. We are movement specialists. And actually, there's a lot of good research that shows that PTs know more about anatomy and movement than any other profession. I think the only profession that knew anatomy more was an orthopedic surgeon, and I would really hope they do, because
right.
They're doing surgery, so that's fine.
Good thing.
But otherwise, we are the movement specialists, and we combine a variety of techniques, whether it be exercise, actual hands-on treatment, education, different assessments, whatever it might be, to help people move the best that they can.
Yeah, that's really interesting. I know when we were talking about this earlier, you mentioned even prevention.
Yes. Yeah, we can play a huge role in prevention. And I would say that's even kind of like a new concept in the PT world, because we're just now realizing how well equipped we are to do that. Movement and exercise has been shown over and over and over to do better than any type of drug, for things like depression, for many chronic diseases. It outperforms drugs pretty much in every study, but specific exercises in a specific way. So, I mean, what better to prevent than to just get people started on an exercise program that works for them? A lot of people aren't comfortable exercising, so that would be the perfect time to see a PT, because we figure out, all right, what could be the problem? Why are you not comfortable? Let's get you exercises that you are comfortable with, and getting you up to the amount of, quote unquote, prescription that you need of exercise to prevent any issues or help any issues that you already do have.
Yeah, that sounds wonderful.
Mm-hmm. Yeah, it's great.
So maybe now you can tell us what led to your interest in physical therapy and pain management.
Yeah, so, I always have trouble with this question. I kind of fell into PT, but it was almost like I was meant to fall into it and didn't realize it until after the fact. So when I was little, I always had chronic pain. Like, my sister always remembers me complaining about my joints hurting, about something hurting, but it was never anything that stopped me from doing anything. So, it was like, all right, come on, Andrea, just get on with it. And I didn't realize it was abnormal. I kind of thought I was just a baby about things. And it wasn't until I was in this class in college where we had to sit on the floor for the whole class. It was like a CPR class. And I had so much trouble with this. Like, I was so uncomfortable all class. And I noticed that nobody else seemed to be constantly shifting around, in pain, uncomfortable. And I was kind of like, that's odd. Okay, maybe something's weird. Again, ignored it. During PT school, I started to have a harder and harder time just sitting through classes. My hips would just really hurt. They'd burn. I'd try and sit in the back of the room so I could kind of slouch in my chair. I started working out more. And just walking up and down stairs, my leg would just randomly give out.
Wow.
And, I wouldn't fall or anything like that. And I just was like, oh man, I must have just worked out really hard. Like, I was so sore. I mean, that soreness that, you can barely move. And I was just like, well, I just guess I work out that hard every day, because that soreness happened every single day. Once I started working, we had this question that we were supposed to ask people that we learned in school that was, do you have pain anywhere else? And I always thought this was such a ridiculous question. I was like, well, that's just going to open Pandora's box every time, and it's going to take 20 minutes to go over, all their other pains. And then I started asking people that, and people were like, no. And I was like, wait, just your knee hurts? And I wouldn't believe people. I'm like, so nothing else hurts? No. And I was like, wait, what? And so that's when I started to realize, oh, the pain that I kind of have all over my body isn't actually normal. So it really wasn't until then that I actually realized that was, something was going on. I also had a bunch of knee pain in high school. I saw a PT for it, actually, and he told me I had miserable posture syndrome and told me there was nothing I could really do about it. And so it was actually my only experience with PT, and it was a terrible experience. That's the worst thing to say to a 14-year-old girl. So, for whatever reason, when I was in college, I really wanted to work with the body, and I wanted to work in a profession that allowed a lot of time with the patients and really time to get to know and get to know each patient and look at them as a whole. And my dad's a doctor, and I just knew the medical profession in most cases doesn't have that time. So I kind of nixed that and ended up in PT just, it was almost by default. I think it was my cousin one day was like, oh, I think you'd be a good PT. And I looked into it. I was like, okay, that sounds cool. And yeah, I wasn't super passionate about it when I went into it. It was just I needed to find something to do. And then again, once I started going through it, kind of realizing how awesome the body was, I totally fell in love with it. So I got lucky falling into the right profession by default or by accident. But
yes. And how long have you been doing it?
So I graduated in 2011.
Okay.
5 years now.
So what's the connection with pain management? Is that sort of a separate entity, or is that just part of the whole physical therapy realm?
It's definitely part of it. And the word pain management, it's a good phrase and it's a bad phrase. I don't love it just because of the fact that, management implies that there's, it has to be managed and can never get rid of. Mm-hmm. So I hope, we're not just managing people's pain, but also are actually getting rid of people's pain. But that can prove to be very difficult in some cases. But I have a special kind of place in my heart for chronic pain just because, once I started realizing it was abnormal and I was trying to see people about it, trying to understand it better, trying to get myself out of pain, doctors didn't really know what to do. There was nothing wrong with me, even other PTs couldn't, just by, a basic examination, it's like, well, everything's normal. There was no test that was showing up as abnormal, so they just kind of wrote it off as, suck it up. Like, it's not that bad. It's not preventing you from doing anything, so just live with it. And either that or they kind of almost, it's like they don't believe you. And so when I get a patient in, who I know has seen many doctors, and you can hear that they're so hard, spending so much effort trying to convince you that their pain exists. I mean, it just breaks your heart because I'm like, I believe you, So I just kind of had a special place in my heart for those people once I really started to understand it myself. So, pain can't be seen. By definition, it is subjective. So I think it's hard for people who haven't been in chronic pain to understand how real it is and that it's not something you can just brush off.
Yeah, no, that's very important. I think, I've certainly had a minor chronic pain, but I have a chronic condition. And, it's people don't realize because it's not necessarily acute that, they seem to think it doesn't, bother you. And yes, you can learn to live with it, but it does diminish your quality of life.
Absolutely.
So I was wondering, maybe how you actually dealt with your own pain. As you were talking, you had pain all over, and particularly in your hips and so on. And so how did you deal with that? So
2 ways. One, I was really focused at the time on some other issues that I kind of have 2 side stories in terms of how I got into the health world. I was on ADD medication since the 4th grade. And I was determined to get off of them. And so in trying to get off of them, which I was actually able to wean myself off of them by the end of PT school, I was working on my diet a lot because every time I would try and wean off, it was really unsuccessful. And then I started reading up on how diet can help. Mm-hmm. So it was I think I took my PT finals without the medication. So it was I literally, stopped them as PT school was ending. So
that was brave.
Yeah. Yeah. I was very determined. So it's in all of that, I was starting to change my nutrition. And it was actually, I think with the nutrition changes that relieved a lot of the overall aches and pains. And even now, if I start kind of falling off my nutrition track and, I went to Florida the other week with my family and, just ate whatever was there. And it's I wake up and I'm and my back hurts. And I squat down and it's and all my joints hurt again. All right.
Right.
Oh, yeah.
Sounds inflammation related.
Mm-hmm. Absolutely.
Yeah.
Yeah.
Yep.
Yeah. So it was that, and then also combined with strength training was huge. The diet I felt took off the main that inflammatory component of it, but I still was achy. I wasn't very strong. I hadn't worked out a whole ton. I had started working out in PT school, but I never really focused on strength training. And once I started kind of going to the gym, and I was just focused on lifting weights, things got so much better. I just felt stronger. My legs weren't giving out anymore. And my pain just, it was one of those things that you don't realize when it's gone. I just woke up one day and I'm like, I haven't been hurting in a while. All right, something's working. So it was really the combination of the two. Hard to know which.
Yeah, that's really interesting. I mean, I actually practice Buddhism, and I'm recent newcomer to this, and we have a lot of, as you might imagine, meditation, and some of our services involve sitting for a minimum a couple hours. Then I'll be actually going up to a retreat in New York, and we'll be sitting most of the day. We do break it up, every couple hours, but there's a lot of sitting. And I've been doing some yoga stuff to try and prepare for that. I was wondering if you have any other tips.
Yeah, sitting is hard. Our bodies really weren't made to sit for huge periods of time. Will you be on the floor or on a chair?
We do have kind of cushions, but believe me, I've tried all sorts of cushions, and I have yet to find what I call somewhat tongue-in-cheek, but the perfect cushion.
Yeah, for sure. Yeah, and I would say, being on the floor is much better than much better than sitting on a chair. When you're in a chair, it kind of cuts off all the blood flow to your butt muscles and the back of your legs, and they just go numb. But when you're on the floor, and really in any position, if you have to be somewhere for a long period of time, and hopefully you're allowed to do this, the best thing is to try and shift positions. Every 20 minutes or so is just...
Really? Okay.
And almost trying to get ahead of that soreness. Our bodies, that's always a really tough one because our bodies really were made to move. And while, yes, people can absolutely tolerate sitting for a long period of time, it's not great. It just, your blood flow kind of becomes pretty stagnant after some time. So if you just are, even if you're cross-legged and you switch which leg is on top, or you put one leg off to the side for a little bit and then switch to the other leg off to the side, kind of being able to move while staying still is probably your best bet.
Yeah, it's interesting because I've talked to long-term practitioners, and they told me that eventually their body just got used to it.
Yeah.
But I'm not there yet, and I do shift around, try discreetly.
Yeah. I know, that's probably, I'm sure that's harder in that setting. And I am sure that they probably get used to it, but it's almost like a hard thing for me to want to advise of a way to sit still for a long period of time. That just seems so against everything.
Right. So how does nutrition complement what you're doing in these other areas?
Yeah, hugely. So, like I said, I just found in my own self that without nutrition, I don't think I'd be where I am now. So I see it in other people. You just have people who they come in and it's everything seems pretty standard about their injury, but they're just not getting better. Or the inflammation is lasting a lot longer than it should. It's been 3 weeks and they're still red and swollen and inflamed and, everything else has been ruled out. It's just inflammation. It shouldn't last that long. So, that tells me that the body might not be able to stop the inflammatory process, which, as you know, as an NTP, that could be a lack of omega-3 or omega-3s or different substances that, the body uses to stop inflammation. Or they could just have this chronic inflammatory process going on because they're eating foods, such as sugar or gluten or dairy that they are reacting to.
Right.
So it makes it really difficult for the body to worry about, that knee pain they have when they're trying to keep their, liver and kidneys functioning. The body is going to prioritize what it's spending its energy on. And, when it comes down to it, your joints are important to your body, but keeping your organs running is going to take a higher precedence. So I feel like it's almost like the body doesn't have time to worry about healing that injury. So as much as possible, I try and, look at people's diet and figure out, all right, what kinds of things can we do to get you, in a little bit more optimal, mindset or, body set for healing. If for acute injuries, sometimes I'll advise people to take the proteolytic enzymes. So the Biotics Int enzyme forte is an example of that, because that'll help kind of eat up the dead cells and help maintain proper healing. And if people are eating a lot of, sugar or things that are very inflammatory, again, just trying to educate them on why that could affect their healing and actually delay their healing. It depends on the person how much I'm going to emphasize PT versus nutrition.
Mm-hmm. Yeah, that makes sense. You had mentioned the term proprioception.
Mm-hmm.
And also, I was wondering if you could talk about the science behind that and how you manage it.
Yeah, so proprioception is basically the body's ability to know where it is in space. So if you're typing on your computer and you have, your cup of water over there, you can probably reach over, grab it, and take a sip without ever, really even looking over at it. Or if you're just walking around and, there's a table there, it's kind of your body knows not to just run into the table because it's aware of its surrounding and it's aware of where you are in relation to your surroundings. So our brain has a map of our whole body, and it's broken up into separate parts. And each part has kind of a representation in the brain. And that's actually called the homunculus. And it's one ugly-looking dude if you look at it. So it's like this guy who has like giant hands and huge lips, because the brain has a much larger map for your hands and for your lips, because those are areas that have a ton of nerve receptors. And so they have increased representation, whereas things like your back and your elbows actually have a pretty small representation in your brain. A lot of studies have shown that in people in pain, proprioception is decreased. And like an easy way or an easy test for that is if you have someone put your elbow, bend it to a position, and your eyes are closed. And they bend your elbow, kind of hold it there for a few seconds, unbend your elbow, and they say, all right, now put your elbow back to where it was. You should be able to match that pretty well. So let's say they bent it to 30 degrees. You should be pretty close to 30 degrees when you rebend it. But some people who are in pain will be completely off, and that just can tell us that their proprioception is off. So the more we train, the more we use our bodies, the better our maps become. So I like to think of it as, if you think of the actual paper road map that we used to use before Google Maps exists, that would be like, your very basic sense of where you are. So your brain, it's like, I know where the roads are, but I know no other details about it, versus being able to bring it up to like street view on Google Maps. Like, I know exactly where I'm going and all the trees around it. You have like much more detail. So, people who are in pain, their maps tend to be much closer to those paper maps. It's just like the basic outline is there. Maybe it's smudged a little. And they'll find that the maps actually will smudge over to different body parts. So the brain will start confusing the hips with the backs and the hips with the knees if you're in pain for a long time or if you're not using your joints. So that's where you get this like diffuse spreading of pain if it's been going on for a while, is that, it's like first you start with your back hurting and then all of a sudden your hips start hurting and your knees hurt. And that oftentimes isn't because the hips and knees got injured as well. It's because that brain's map is actually just smudged. It doesn't know where things are coming from anymore.
How does that relate to something like phantom limb?
Yeah, it does a lot. It's basically like that smudging is basically a huge reason for phantom limb pain. It's an incorrect representation of what's going on in the brain. Yeah, and I haven't worked with that specifically, so I don't. There's a ton of really cool things about that, but I haven't worked with it specifically, so I can't speak to it a lot. But it definitely all plays. It's like phantom limb pain is like the kind of the most extreme example of like wiring gone awry, basically, with pain.
Mm-hmm. Yeah, I know we also talked briefly about neuropathy.
Mm-hmm.
And someone's sort of sensory, their perception of their feet, if they have neuropathy, which is nerve damage in their feet, they kind of lose that sense of, I guess I was saying peripheral vision. I think a sense of where their feet actually land.
Mm-hmm. Yeah.
Like when they're walking. So this person has to like look down to see where she's walking.
Yeah.
To make sure she won't fall.
Absolutely. Yeah. And that's because the brain can't even get any information from the feet at all. So it's definitely not getting any proprioceptive input because those nerve endings have basically been oftentimes either damaged or destroyed in that process. Yeah, I like to think, if you think about like proprioception, a good example is that if you're, in your own house that you've been in for a long time, your same room, same furniture, and you get up in the middle of the night to go to the bathroom, it's like you kind of just know where everything is. You can pretty confidently walk through your room. You kind of know where to stick your hand out maybe, but you can just get up and go. Versus if you're in a hotel room, and it's pitch black and you get up and you have to go to the bathroom, you're probably like walking around like hands out, really cautious, shuffling through because you just don't know where things is, where something might, just jump out and smack you in the knee. And that's kind of how the brain will operate if proprioceptive input is decreased. Like it's kind of in this constant like scared mode of like, okay, I don't know what's about to happen to me because I just can't see what's going on. I don't know where things are. So it's like really on guard.
It's almost like you're disoriented.
Mm-hmm. Yeah. Yeah, that's a great way. Yeah.
So what's the difference between chronic pain and injuries that may be painful?
Yeah, so let's talk about like the difference between pain and injury because that in itself can be a pretty confusing thing. And chronic pain itself is a huge, huge problem too. So I actually looked up some numbers on this because I was curious. So it's actually up to 11% of Americans are in chronic pain. That's a pretty high percentage. Like 1.5 billion people worldwide have chronic pain. And it costs America up to $635 billion each year. Like that is huge. Chronic pain is a huge, huge problem. So in order to, kind of start knowing what to do about it, you have to understand what is pain. And so there's a ton of different definitions of it. Different kind of associations will, they all have their own definition. I like the one that's from the International Association for the Study of Pain. They describe it as an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or it's described in terms of such damage. And that described in terms of such damage is that where you get someone without any type of injury, but they're describing it as an injury. So like, oh, my back feels like it's on fire, or, it feels like something is stabbing me. So it's described, in such, even if nothing is actually causing your back to be on fire or stabbing it. So a lot of people report pain in the absence of any tissue damage or any likely pathophysiological cause. The definition kind of purposely is avoiding tying pain to a stimulus because they're different. So it's kind of leading back to your question. Injury, like the actual injury that you were asking about, is when actual tissue damage occurs. But we can have injury without pain. So if you think, let's say you see a small child about to run into traffic, okay, and you're running after that child trying to stop it, and you step on something that's sharp, you step on a sharp rock, chances are in that moment, you're not going to really pay attention to that, right? You'll probably keep running and save the child. But if you're just walking along a path and all of a sudden you step on something sharp, all of a sudden you'll be like, ouch, that hurt. Does that make sense? Is that?
Yeah, totally.
And that's because, so that's actual damage occurring, but without pain at first, when you step on that. Or you get those athletes who, break their finger in the middle, like a football player that breaks their finger in the middle of a play, and they just keep playing it. They didn't even feel it. They didn't notice it. It's because their brain just didn't register it as pain, or it just decided, that it wasn't important in the moment to tell them that it was painful or that they had an injury. They had other things that were more important going on, basically. So the other thing you can have is a bruise that's like actual tissue damage, and it doesn't even hurt. You know, have you ever had that bruise where you don't even know where it came from?
Yeah.
And it's like, a lot of times it won't even hurt. Maybe you poke at it a little bit. You're like, that's weird. And it's like, okay, that was actual tissue damage, but no pain. But then the more problematic thing is the other way around, is where you have pain, but no actual tissue damage. And a lot of times it's from an old injury, maybe. It doesn't have to be an injury that occurs, though. An injury itself, if you strain a muscle, or like sprain a ligament, I mean, at most you're talking 10 to 12 weeks to heal completely. I mean, at that point, the body's done everything it can to heal it. So anything lasting longer than that, it's not from the injury itself. But pain can obviously persist much longer than this. Pain itself is like unlike other senses. So you have your five senses, when you see, vision and then hearing. And in those, when you're exposed to something over and over and over, they adapt. So if you ever had you put on your pants and you initially feel them on your legs, but as you're walking around, you just don't feel your pants every single time you're taking that step, right? Mm-hmm. You just kind of adapt to that. But pain amplifies with repeated exposure. So think about like a shoe that's rubbing. You can ignore it at first, but once it starts, kind of really rubbing, causing that friction, it's like, I don't know about you, but it becomes like debilitating. It's like you can't even walk once that like little tiny blister starts to form. Like you're done. You have to take off your shoes. So it's like, and it's like pain. I don't know. That's at least for me. It's like pain up my leg, and it's like, what the heck? It's like this tiny little blister. This is a really good example of how like pain amplifies. So, even in that instance of that tiny little blister, the amount of pain you feel from that is so disproportionate to the actual injury. So they're really poorly correlated in most cases. More pain does not equal more injury, or vice versa, which is just a pretty important thing to note. And in some cases, we actually only will feel things that we have receptors for. So we have receptors for like pressure, stretch, mechanical forces, temperature, chemicals, and that will send a message up to your brain. Those are your nociceptors. A lot of people incorrectly call them pain receptors, but they don't feel pain. They are just telling the brain, hey, the temperature is getting really high, or hey, there's an inflammatory chemical here, or something is stretching me way too much. You should probably pay attention to this. And then our brain...
For all those people overdoing yoga.
Yeah, exactly, yes. Your poor little receptors are like, all right, and I think that's enough. Your leg is now over your head. Okay, we're done. That is what tells people to stop. So it tells our brain about it, and then our brain interprets the signal and decides how to respond. And the brain can kind of take a survey of what's going on, and this is all happening in a millisecond, completely unbeknownst to you. Take your yoga example. You have someone who is, does yoga a lot. They're used to stretching to their max, and after they do, they feel a ton better. Your body's going to take that message of a big stretch and be like, all right, we're fine. Like, I've done this before. It always works out really well. Like, I feel better after I stretch. All right, cool. Keep stretching. But then you have someone, let's say they broke their wrist, they've been in a cast, and now you can take them out of their cast and you go to stretch those muscles, and your brain's like, whoa, what just happened? Like, those muscles haven't been stretched in 6 weeks. I don't know what's happening. And it's usually very painful at first, even though the stretch is almost nothing. You're barely even moving your muscles. So let's say that person who broke their wrist was someone who did yoga. Chances are they're going to be able to kind of get back into their get their mobility back a lot faster, because their brain after, probably a few times of stretching, maybe a week or so, it might realize, all right, I've done this stretch before. I know what to expect. This is fine. This is safe. But somebody, let's say now you have, an older person, they really haven't moved their wrist much to begin with. Maybe they were in a nursing home, so they just, weren't doing a lot of motion. Their body or their brain is going to perceive that motion as very much of a threat. It won't really, know how to respond to it, and it can be very, very painful, even though it's not a danger and it's not causing any damage.
Right. It sounds like their muscles are more contracted.
Mm-hmm.
Is that
But
accurate?
but you can have pain even in the absence of like a more contracted muscle. Like even it's like to the PT moving it, they might be like, I'm not even feeling any tight muscle. Like there's no reason it feels like I should have to stop or you should have pain, but the person has pain. Mm-hmm. And the important thing is, even though it's our brains that are always deciding, our brain is the brain is the thing that tells you that there is pain. Without your brain, there is no pain. It does not mean it's in your head, though. The pain is very real, very, very real. So that's the kind of the important thing to make sure that people know.
Yeah. So speaking of pain or injuries, is it helpful to get an image, like an MRI or a CT scan of the area?
Most of the time, no. It is just an image in time, basically. And while there are a few exceptions, most of the time an image is going to show you stuff that often just scares the person and isn't valuable. There's been no correlation between image findings and actual function and pain. So let's take your back, for instance, because that's a really common thing to MRI. If you take there's been studies that have done this. They take a bunch of healthy people, they have no back pain, and they MRI their backs. And they find all kinds of stuff. They find degenerative discs, they found, joint disease, herniated discs, all kinds of stuff. And they have no pain, though. Like up to 50% of them have findings on their MRIs and no pain. And then the study follows up with them like 10 years later, and they still have no pain. So, in that case, if you have someone with back pain and you MRI them and they have a joint disease, it's kind of like, all right, well, that might not be what's causing the pain. Like, we don't know anymore. You can't see pain on an MRI, basically. And even in, when you take, pro athletes, a lot of them have all kinds of, baseball pitchers and things like that. They all have major rotator cuff tears, things going on, but they're all still pitching, and they don't have any issues. They're all star pitchers, and they're doing great, but they have tears. So it's kind of like, what's the significance of that? Most people, when they find out they have something like that, it scares them, and they don't want to move because now they're scared that if they move, they're going to tear something more or they're going to herniate their disc more. And doctors often talk about it, and not just doctors, every healthcare professional is guilty of this, talk about it in terms that are really scary, like, oh, wow, your disc is bulging out. Wow, if you bend forward, that thing just might go flying across the room. You know what I mean? So people become really scared to move. And then as they move less, we know, I talked about proprioception, their proprioception gets worse, their pain's probably going to get worse, and it becomes this vicious cycle, all for, really no reason, because having that image didn't help anything.
So are you saying that people, when they have some kind of diagnosed injury that isn't causing them pain, they should continue playing whatever sport they're doing or, continue a repetitive motion, or should they ease up on it?
No, if it's not causing pain, keep going, keep getting stronger, keep moving it. It's going to keep the joint healthier. Now, in terms of since you said repetitive motion, yeah, there's absolutely some manual laborers or, certain things. If you're literally doing the exact same thing all day long and there's no variation to that movement, you're probably going to run into some issues, and it might not be because you're wearing down a joint or doing anything. It's more of just the lack of variety to your body usually often leads to pain. So even just switching it up, trying to do things with the other hand, trying to take breaks, what I talked to you about, not sitting in one position for too long. The same thing applies to any type of repetitive motion. You shouldn't be doing the same motion for hours and hours in a day.
Yeah, and I think that's what's tricky with sports is because, they're very precise, specific motions in a particular sport or game. I'll take tennis since that's what I play. when I'm serving, for example, and I'm right-handed, so I always serve with my right arm in hand, and it's a similar motion time after time after time, because that's just the nature of the game.
Yeah.
So how could and I don't think I could serve well left-handed.
Yeah, and you don't have to. Yeah. it would be good. It would be a good mind game, and good for your body to, in practice, do some left-handed serves just to, keep things spiced up there. But, you don't have to, try and learn to play tennis left-handed or anything. But the thing is chances are you're not playing tennis, for hours and hours a day, every day. So if it's just, the weekend here, I don't know, you can tell me how.
Actually, I'm playing up to 4 times a week for a couple hours.
Yeah, and that's fine. So I wouldn't be, super worried about that at all. As long as then when you're not playing, you're, giving the rest of your body different feedback. So where specific sports tend to run into issues is when all of their practice times, all of their other times is also mimicking that same repetitive motion. So let's say in all of your free time, you were practicing your serve, that's kind of what you did. That would probably then lead to an issue just because you're only working the same muscles over and over. But if in your free time, you're doing yoga, you're doing other activities, whatever, you might like, you're just doing some basic strength training, getting the other muscles around your shoulder working, especially like your back muscles, because a lot of that serve is your shoulder going forward. So if you're kind of now moving your arm back, working those back muscles, shoulder blade muscles, you'll just balance everything out, and it's usually not going to be an issue. It just, everyone is going to be different in terms of how much, I guess, recovery work and other work they need.
Yeah, I think I've known that I should be doing more strength training for a while. I tend to focus more on stretching, which also helps and prevents injuries. Do you agree with that people need to stretch more before they work out?
Not necessarily. It depends. So stretching in itself, needs to be, that's like a big topic. There's actually really been no research that supports just stretching before workout. It's better to be doing more of like a dynamic warm-up. So, getting your body moving slowly, starting to mimic some of the activities you're going to be doing. So, even mimicking like a serve activity, just, getting your joint moving in that motion is going to usually be a little bit better off. It gets your body a little bit better warmed up than just a stretch. Holding a stretch too long, you're talking like 90 seconds or more, can actually decrease like the power of a muscle. But usually that's more of an extreme stretch. Nothing's wrong with, bending over, touching your toes, and like just kind of warming your body up. If you have stretches that you really like, it's definitely not going to harm anything. But if people have to do anything, any one thing, a more dynamic warm-up that mimics the activities they were going to be doing is usually going to be the most optimal thing to do.
Yeah, one thing I like too about physical therapists, and I have seen a few in my lifetime after actually a lower back injury, was they gave me homework, which is exercises to do. So I do have an exercise ball, and actually I incorporate it's like a spine warm up where you do, and the chiropractor may have given me these specific ones, but I would think a physical therapist would probably agree with these, which is you do like 30 circles to the right. They're small circles. You're sitting on the ball, and then you do to the left, and then you do side to side, and then you do the flex, the hip flexors, where you're actually rolling up on your calves and so on. And since tennis, you use your legs a lot too. I find that's helpful for keeping my calf muscles from getting really tight.
Yeah, absolutely.
So do you have other exercises? And maybe we can pick another sport if you want. I know paleo people are big into CrossFit. I don't know if you see many injuries from that, but maybe give us some tips on what people can do to kind of prevent some of these injuries.
Yeah, so it's hard to just pick out any specific exercises because everybody is so different in terms of what they need. for CrossFit, I mean, I do CrossFit, and CrossFit actually, out of a lot of sports, they have some of the least amount of injuries because their emphasis has so much strength training in it. And the more strength you're doing in general, the less injuries you're going to have in a sport. So the stronger your joint is, it's like the more abuse it can take, basically. But, you know, if you're going to be doing squats in your workout, your warm-up should consist of whatever it takes to get your squat really good. So for me, it's like I have my hips are always just a little bit tight. And so I have my, I actually will use like a ball on like the back of my hamstrings, where like my hamstrings and glutes connect. And for whatever reason, for me, I find when I roll that area out, like my squat gets, I don't know, 50% better in, you know, less than 3 minutes. But that's for me. Not everyone's going to have that benefit. It's, I don't know why I have that there either. But the other common thing is people go from sitting all day long to going into their sports. You have someone who's been in their office job all day, and they're like, all right, now I'm going to go hit up CrossFit. And that's where you kind of are more like, or runners are also the same thing. So you have, you know, someone, your body's just not been moving all day. We kind of talked about that earlier. Your blood flow gets a little bit slowed. Maybe your muscles are a little shut down. So starting to wake them up is a great thing to do. So even just a simple bridge, you know, getting on your back, squeezing your butt muscles and lifting up your hips, and making sure it's your butt that's doing the work and not your back is a great, really basic exercise just to warm things up. The level of the athlete's really going to matter too. So someone who is about to go, you know, squat 300 pounds might have a different warm-up than someone who needs to warm up just to go walk. You know, it depends on the body type and what they're about to do. So. Okay.
Yeah, and it depends where people are starting from.
Mm-hmm, absolutely, yeah. I mean, someone's warm-up could be harder than someone else's actual workout, right? I mean, and then just because that's where they are, you know. So it's really hard. Yeah, it's really hard to give any specific exercises without knowing more details.
Mhm. So what advice do you have for people who are just starting to exercise again after their injury? Mm-hmm. You know, you've worked with them and it's been rehabilitated.
Yeah, so going slow is important. If someone is used to working out, like you have somebody who's come in and they're like, I work out, you know, 5-6 days a week, and I want to get back to working out, get back to the gym, and they're coming back from an injury, for them, it's probably going to be slowing them down a little bit. Because if you go and do 10 different exercises and then maybe your knee hurts again, it's kind of hard to know which exercise did it. Or did you not warm up enough? Or did you just do too many things all at once? So it's just harder to kind of like sift through the weeds, I guess you can say. So if you're adding, you know, 1 or 2 exercises in at a time that are, you know, relatively pain-free. And when I say relatively pain-free, an important thing about pain is that your baseline pain isn't increasing once you're done with the exercise. So for someone who doesn't have pain, if they're doing squats, and each rep, that pain is starting to get worse and worse and worse, then all right, and then they stop, and then it's achy. All right, something's that, you know, that's not agreeing with their body right now. We need to figure out what's going on. If they do a squat, the first few reps, it's like, oh, my knee is feeling that a little bit, but then as they keep going, it feels looser and looser, and then they're done, and it's like, oh, now it feels great. Perfect. Like that little bit of pain they felt at first is fine. For someone in chronic pain, if they're, you know, at a constant 5 out of 10 pain, and they're doing an exercise, and it maybe puts them to a 6, and stays there, and then once they're done, they're back down to a 5, if we're lucky even less, that's fine. Like that is, you know, okay, because it's more important that they're getting that movement in than having like a completely pain-free exercise session. So just knowing and listening to your body is really important. Going slow enough that you could feel confident in knowing what exercise may have bothered you if you know, do something to flare things up is really obviously recommended. For someone who hasn't worked out in a really long time, just starting to walk is a great way to start. Going really easy. Maybe it just means you walk down to your mailbox and back, and that's it.
Mm-hmm.
It's wherever you're starting. I had someone who, she was actually my very first evaluation completely on my own out of physical therapy school. And she comes in and she's like, yeah, I've had pain for 40 years. And I was like, all right, this is going to be fantastic. Kind of that, like, all right, not getting an easy one the first time. And when she was 16, she was in a car accident. And she actually fractured some of her vertebrae. And basically didn't move much since then. She was like 50-some at the time when I saw her. And she came in because she kept falling and was starting to notice that she was getting weaker and weaker and weaker. And she had a constant, like, 8 out of 10 pain.
Wow.
Everything hurt. Anything we tried to do hurt. So with her, I ended up working with her almost basically the entire time I worked at my other clinic. On and off through different physical therapy. She was in group classes. She did some Pilates. So it was a lot of different modalities that we were using. And it was just, getting her to do whatever exercise that she could tolerate. There was obviously all these great exercises I had in my head. I'd be like, okay, we can work on this and this, but, we'd go to do it and it just wouldn't work. She wouldn't do it. She wasn't comfortable doing it at home. She wasn't comfortable doing it in the clinic. So, it's just constantly changing it up and finding a way that, you can get the patient on board, or, with doing exercise and movement to whatever their capacity tolerates. And by the end of working with her, she was falling probably at least once a week, sometimes more. And every time she would fall, it would, scrape up her knees and make her hurt even worse. So it was like always like going forward, half a step and back 5 steps every time. But by the end, I think she had gone 6 months without a fall. So
that's great.
It was pretty significant. She actually, when she would get home from work, when I first saw her, she was sleeping on her couch because she couldn't walk up her stairs. By the end of the day, she was so tired from being at work, and she didn't trust herself to walk up the stairs without, like, falling down them. She was back sleeping in her own bed upstairs. She could walk up the stairs confidently. She was gardening and doing housework. And her pain, though, was still pretty high. I think she was, like, at a 5 out of 10 when we stopped at a baseline. So it came down, but still living in, a significant amount of pain every day. But her function was so much better. I tried really hard to get her on the nutrition board, but she wouldn't budge, and she basically lived on Pepsi and, like, M&Ms and stuff. So
my God.
I think she may have, cut down a Pepsi a day or something like that by the time we were done. But it was like I was constantly bugging her about it, and she just wasn't willing to go there. But that was all through exercise that we got her function significantly better. I mean, she hadn't moved or exercised a day in her life, basically. So, you see.
Well, that's amazing transformation.
Mm-hmm. Yeah, you see really cool things. And the patient has to be willing to do it, though.
Absolutely. I think we talk about pain points, and when people are experiencing enough pain is often when they're ready to change.
Yes, yeah, absolutely.
So speaking of that, when should someone seek a physical therapist?
Basically any time. Really, if they want to just know if they're doing the right things, if their, movement patterns look balanced, if, there's any potential for, it's hard to predict injury. There's really no great way to do it. But, as a PT, usually if you're, again, all right, I spend all my time serving with the same arm for hours a day. All right, well, let's at least balance out your program. Maybe you will never get hurt, but there's a chance you might, and you're probably increasing that chance. So let's at least reduce it. Let's balance out the rest of the things. So a PT can look at that. They can look at your overall program. They can do a movement assessment. They can do strength assessments and figure out if there's any points that just need improvement. If you just have everyday aches and pains and you're not really sure why, maybe they're not really getting in your way, but it's enough that it's annoying you, like, you can see a PT for that. You don't have to wait for an injury to occur to see a PT.
Yeah, I like that you said that because I don't think that people, including me, associate PT with that. It's usually prescribed by a doctor after you've had an injury.
Yeah.
So I think that's a really important point to mention.
Yeah, and a lot of people, I'm actually glad you brought that up. So in most states, you do not need a prescription to see a PT. In some states, you don't need a prescription, but if you want your insurance to cover it, they might require one. Like my insurance right now requires me to have a prescription to see a PT, which just made me laugh. But
a little irony there.
All right, it's silly, I think, because now you're just wasting more money to go to see a doctor and just to get a prescription, but. You don't need a prescription is the point. In most states, there are a few, and I don't know them off the top of my head, that do require that. But like I know in like Washington, D.C., you don't need a prescription. They can see you. And same thing in Virginia. They can see you, right off the street. Come on in. And I would say when you're looking for a PT, some PTs, and nothing is wrong with this, kind of just still practicing the old school rehab model. So if you come in and you don't have pain, they might look at you kind of funny. And I think that is where that misconception comes in, because there probably have been people that have been that have walked into PT and said, I just want to make sure everything looks okay. And the PT's like, you don't have pain. What do I do with you? So you want to make sure you're going to a PT that is, ready to do that type of assessment and wants to see that type of person, more as in that prevention type of mindset.
Mm-hmm. Do they need to, are physical therapists licensed? Is that what kind of credential are you looking for?
Yeah, so, any PT graduating now is going to have their doctorate. So I have my doctorate, and it means that when you go to a PT, they're going to know if there's something more serious going on. So, if you have back pain, and for some reason the PT feels like it's, something more serious, they are well equipped to pick that out and refer you to the appropriate person, which is really important. So you just know you're in good hands. You're not going to be getting treated for some, serious illness. The PT is going to know and be able to refer you. And they might, since they have a full hour with you, usually for the evaluation, they might pick up on things that your doctor never was able to even pick up on, just for the lack of time that the doctor had with you. Mm-hmm. Basically any recent PT graduate is going to be a doctorate. If they're not a doctorate, they're going to have their master's. So all very credentialed. If you want someone who's more specialized in orthopedics, you can look for the OCS, which is what I have, the Board Certified Orthopedic Specialist. And then there's also an SCS, which is a sports certification specialty. And those things, though, someone doesn't have to have those to know a lot about sports. There's a lot of PTs out there who also are athletic trainers or sports coaches, things like that, that'll all really know their stuff when it comes to sports. And in fact, there's a whole group right now that's called Clinical Athlete, and you can go to their website at clinicalathlete.com, and they, the PT who started it, he basically is personally interviewing every single PT or practitioner. There's a few other. There's like some nutritionists and massage therapists and chiropractors on there, I believe, as well. And basically personally interviewing, making sure they have this mindset of holistic care, prevention, whole body treatment. And so if they're listed on that website, chances are they know their stuff. And there's you can find them PTs all over the country, and there's actually international PTs on there as well.
Sounds great.
Yeah.
And where can people reach you, Andrea?
Yeah, so I'm at lifelibertyhealth.com, and that's my business page. My website's not super fancy or anything like that. I'm not very good at that side of things. So if you have any questions, feel free to reach out to me. There's a link right at my page that you can email me directly, or my email is andrea@lifelibertyhealth.com. And feel free to email me any questions whatsoever. I work with people both in person if you're local. I'm in the Seattle area. Or I also do Skype consults and work with people over Skype.
That's great because we have an international audience.
Yep, absolutely. I am available to them as well.
So I will list these resources in the show notes, and I want to thank you so much, Andrea, for being on the podcast today.
Oh, absolutely. This was great. Thank you so much for having me.
You're very welcome. So next episode, I will be interviewing Dr. Maya Shatreat-Klein, a pediatric neurologist, herbalist, urban farmer, and naturalist, about her book, The Dirt Cure, Growing Healthy Kids with Food Straight from Soil, which has been translated into 10 languages for our international listeners. So thanks, everyone, for listening today, and have a great, healthy week.